Hey, it's Paul. Day 3 of my journey from a knee replacement surgery. I had a partial knee replacement on my left lateral side. Thought I'd tell you guys how it's going so far. So first of all, I've been using the crutch to get around, just a single side. I could definitely walk without it, but really don't want to. I want to, as my doctor said, is just make sure to watch the swelling because the swelling definitely will come up if you work it too hard. So, been using the crutch. The single crutch has been perfect for me at this point. So let's take a look at the knee. So I've been wearing these compression socks, or these compression leggings they told you to wear. And I think you can see that it's quite swollen. And that's what happens on this third day. And you can really feel it in the front side, the back side, all over. And that's a lot of the, not only the pain, but it's hard to move because there's just so much fluid in there. So that's why they want to get you around and move a little bit so that fluid can kind of release, not build up. And the bike's been great with that. So when you get on the bike or any kind of movement, you can definitely feel afterward that there's less fluid buildup. At the same time, icing. So yesterday, we talked about my second day. My second day was definitely the worst. And by far, that was the most pain. And looking back at it, and what they'll probably tell you to do is track on your pill sheet when you take your pills, but also how you feel. And I felt so good after that, right after the surgery. I didn't take my hard drugs for 48 hours, actually. And kind of came back to bite me a little bit yesterday because I waited a little too long into the day, and it definitely hurt. I got pretty sore going into last night. So I went back on the harder drugs, slept well, which was really important. And today I feel a lot better. I've been sleeping with ice as well. I have a really cool ice machine, a polar ice machine, which I'll show you guys in another episode, and that really helps. So today I have physical therapy in a couple hours, and I really wanted to work hard over the last couple days to get to show my progress to them. They can do some measurements and then give me new exercises. So what I've been doing is pretty much the same thing as I showed you yesterday, mainly about flexibility with the chair over here. And man, these calf raises, these calf stretches have just been fantastic. They feel so good. I do these a couple times a day because it is so tight in the calf because of all this fluid buildup and everything else. So really recommend you guys get these things. It just feels so great. With the bike, I spent about 20 minutes on the bike today, and it feels so good. And I'm just barely spinning. I mean, I'm spinning with no resistance. It's just to get fluid moving around, get your knee moving a little bit, not standing up or doing anything. And like I said before, used bikes are really easy to get, and I highly recommend you guys get one if you can, if you have the space. And try to do it before, like we talked a little bit about prehabbing. Your first time on the bike probably shouldn't be right after surgery. If you are lucky enough to get one, have space for it, maybe take a couple weeks beforehand or even a month beforehand and get on the bike every now and then. So one interesting thing is, I worked a lot on, again, prehabbing, which I hope to do another episode on a lot of the work that I did. But you'll be surprised about how much you rely on your other leg right now, because your other leg is doing a lot of work, a lot of balancing work. And you'll be surprised when you get out of bed, when you have to go in the shower, whatever, that you are going to be using this other leg that was not the surgical leg for balance, for just making sure you can get around. And so the more work that you did beforehand, and I've got some really cool balance exercises I can show you again in another episode, it'll really help out a lot, because you'd be surprised, just getting around and doing things like going to the bathroom or, like I said, showering. It really helps to have a really stable other platform here. So yeah, that's day 3, and I'm pretty excited. I think as far as the pain index, it's definitely less than day 2, and I kind of hope it goes from there to just slightly less every day. We'll see. And again, icing and getting down and doing your rehab. I mean, just coming in here and doing these stretches and the things that they told me to do, I feel so much better, just to get the blood flowing, get things moving, and don't push too hard. And that's one thing my doctor, who I've been talking to a lot via their messaging system, is great, but just don't push it too hard. Listen to your body. So that's it for today, and I hope to see you tomorrow with maybe even better results and hopefully less pain. Thanks a lot.